Hello, my name is Nicole Jacobs, and I'm the Domestic Abuse Commissioner for England and Wales. I'm really thrilled to be recording this video for the End of Network series for the Violence and Abuse Mental Health Network. I can remember probably before I was even appointed into this role when I first heard about this network and the fact that so many people that I knew and admired working in this field were coming together and had this incredible opportunity to develop practice and knowledge about domestic abuse and mental health, which is so needed. And I remember that excitement that I felt in hearing about the network. And as I've changed roles and moved into the role of Domestic Abuse Commissioner, hearing from time to time sometimes a little bit closer and sometimes from a distance, the incredible work of the network. And I will be very, very anxious to be watching the whole series of videos, which I know will be posted by the network so that we're learning from the various projects that have been funded by it. And I'm really excited to do that. And I can tell you that I will be asking my team and will be promoting people to watch these videos and really learn from them as well and be thinking about the next steps in terms of practice development, funding, policy, and all that we can learn as a huge stepping stone from this network. I don't need to tell you, if you're watching this video, the links between domestic abuse and mental ill health. We see this very much as a part and parcel of a direct effect of domestic abuse. We know that women who are subject or victims who are subject to domestic abuse are 3 times more likely to suffer from mental health conditions. We know that perpetrators of domestic abuse often are accessing mental health services or community-based mental health care, and that we need to build much stronger links about the recognition within those networks about perpetrators of abuse and the thoughts and care and attention towards their current and former partners. And obviously, children. One of the things that I would like to highlight for network members and those who are interested in this network is a mapping report that my office published recently, where we brought together several data sets. One was, and the most important, was hearing from victims and survivors of abuse who've been subject to abuse in the last 3 years and were looking for services. And one thing that really stood out is the gaps in what they wanted and what they were able to receive. We took that information and mapped it alongside the actual services, going directly to specialist domestic abuse service providers and asking what they were able to provide, what they were funded to provide, and we coupled that with some information from commissioners. And that's on my website. It's called Patchwork of Provision. And it feeds directly into the kinds of things you'll see and hear about in these from this network. Most prominently was that victims and survivors of domestic abuse said that they wanted, in fact, one of the top 3 things they wanted was therapeutic support and mental health support and counseling. It was also one of the greatest gaps in terms of what they were able to access. They wanted the same for their children. Almost 100%, just under, of survivors who responded to our survey who had children felt their children needed help and support, therapeutic support. And again, huge gaps in terms of being able to access that. And when we mapped that with services, of course, we see a lot of gaps and quite a lot of regional variation, in particular for children, where you have some regions of the country having a little bit greater provision than others, certainly not across the board enough provision anywhere. So we have a lot of catching up to do about the most basic therapeutic support and counseling. And I think we have a lot of catching up to do in terms of understanding between us about what good looks like for the whole range of mental health and therapeutic support. And what I mean by that, and having not been working in mental health trusts myself all of these years, most of my background is working directly in frontline domestic abuse services or an organization called Standing Together, which is a lot about the kind of coordinated systemic change needed for domestic abuse. What we don't have is a very clear picture of what is the therapeutic mental health support range of support look like? What does good look like within mental health trusts, within community health settings, within the charity sector or the community-based sector, third sector of support, and how that knits together for domestic abuse? We often hear people saying there is simply not support available, or quote unquote, not meeting thresholds of support. And yet we know from research this such strong link in terms of mental health effects of domestic abuse. So we have a lot to do, we have a lot to learn, and this network is a great place for us to look. And I would encourage us all to have a look at these videos, learn. I certainly will be thinking about the kinds of things that we can take forward, that we need to push for more funding, for more development. And you certainly have an ally in me in doing that. I know that in the domestic abuse plan, there was some allocated funding for quote unquote health responses. And I think we have some real opportunities in looking towards the Pathfinder partnership, which of course originally the original partners were Standing Together, where I used to work, also AVA, Against Violence and Abuse, Safe Lives, IMCON, and of course IRIS-I. These are all great starting points within the domestic abuse sector, very important organizations to be looking towards. And now, with a little bit of continued funding, I think there's going to be a much more proactive work within using some of that starting points in Pathfinder. Which of course will have drawn on many other work prior to that, and some that you're familiar with in this network, to really build a greater, more of a momentum, essentially, for the changes we need to see. I'm also really heartened by the fact that in NHS England, there is now a domestic abuse team. There had been a sexual violence team. Now there's a small and emerging and very active domestic abuse team headed by someone called Catherine Hinwood, who's been working really closely with my office about thinking about that whole provision of what we might call a whole health response, which obviously includes very strongly mental health as part of that picture. A new clinical director for NHS England has recently been appointed, who has a mental health trust background. So these are all the kinds of things that I think we can really look forward to, drawing the experts within the Violence and Abuse and Mental Health Network, experts and expertise together, and thinking about the ways that we can really fill or start to strategically work towards filling these very, very serious gaps. We have things like a serious violence prevention duty, which is bringing health partners into scope in terms of thinking about prevention of violence and abuse. We have integrated care boards. There's so many levers, and there's so much to do about looking to how we can learn from those of us and those of you who've been doing work on these issues and really practice development for many years. So I hope that gives you a sense of where my mind is in, as I will be watching these videos and thinking about this end of network event, and really want to state again my thanks to those who've built this network, who had the vision for it, who've done such a lot to pave the way and open up possibilities for our work into the future. So please know how thankful and grateful I am, and how much I am interested to learn from this event and others. So those of you who would like to tell me a little bit more about projects or things that you've been involved in, please get in touch with my office. People at the network will certainly know how to do that. And I wish you the best. And again, my thanks for all of your hard work.